There are a lot of things pet owners have to think about these days, from food to shots.
Yeah, it can be easy for some owners to overlook dental care, but you don't want to do that, because if it becomes a problem, it becomes a big problem. Here with what you need to know about pet dental care, our resident vet, Dr. Eric Ruhland from St. Paul Pet Hospital. Hello, and Butter.
Good morning.
And Butter.
Hello, Butter.
Happy Monday, you guys.
Happy Monday to you, too.
Yeah.
Okay, this is one of those things, again, you know about the vaccinations, keeping up on that. I've got to do this, I've got to do that, I've got to get the nails trimmed. That's kind of like in your face. It's easy to maybe neglect dental care.
Absolutely. Well, it's something you don't look at every day, and it's something that pets never communicate when they have oral pain or they have sensitivities in their mouth. You're never. A lot of owners in my, when I do an oral exam after I'm done, and we're chatting with owners, a lot of owners would never know that their dog has a fractured tooth or has an abscess somewhere, or has a tooth that just needs to be extracted. Most people would never know.
They would never know.
No.
Okay, so I guess the important thing is to understand what some of the signs are, and they come up pretty early, which surprises me.
Yeah. Most of the time I'm seeing disease, and I'll classify. I'm just going to speak in some generalities, but the smaller the dog, usually the faster they're going to put plaque on their teeth, and I can get into the reasons of that. But usually by the time 2 or 3, I start to see some plaque formation, and normally it's on the upper premolars. Hey, Butter, come here, honey. It's usually right up on these teeth, right up here, on this upper quadrant.
There's the camera.
Okay, let's turn this way. This
He's
upper
like,
quadrant right here is one to really pay attention to, right up here on this side.
Okay.
We call those the premolars, those aren't molars, but right up here, that's a really common spot. If you see any plaque on those teeth, that's a good sign that we're going to have to probably get in and do a little bit of a cleaning. We can get into that in a little more.
Because plaque doesn't necessarily mean major issues.
No,
it's just something to be aware of.
It's a signal. It's sort of like the canary in the coal mine. It's just telling us, how much disease or how much plaque I've got in there. Because if there's some there, it's going to be in other places. But you want to look for gingivitis in that area too, and redness and irritation. So.
Well, we know that that's something that veterinarians provide as dental care. Are there such thing as a doggy dentist or a cat dentist? I mean, hopefully they can get in sooner than April, which is the case for some humans like me right now.
That's a really good point, Alex. So yes, our hospital, we're booking out about 6 months to 4 months to get dental, just routine cleanings done. Is that something we do? We do it all the time, and we do it on the regular. And a lot of people come to me and ask, like they really want, they don't want to put their pet under anesthesia to have this procedure done. A healthy pet that has no other underlying disease, there should be no hesitation to go forward and go in and get these teeth cleaned up. The other thing I remind people, and people are like, well, why do I need to do this? Like, I don't want to have this done. Well, wolves in the wild, or or coyotes, or any of our other, when we talk about the canids, like, they're never going to age this well. They're never going to age this well and age this long. So this is a pathology that they never deal with generally. So plaque and gingivitis and all that, it's something that we have to control in our domestic species, but we don't see it very often, in wild animals.
So obviously, like with anything, prevention is key.
Yeah.
So is this like once a year, twice a year?
Every dog is different.
Okay.
My old lab Maverick, I maybe had to have his teeth cleaned every 3 to 4 years.
Oh, okay.
I had a Whippet that I had to clean her teeth every 6 to 8 months, which I know sounds excessive, but she did fantastic. And every breed is a little bit different, so you want to follow your veterinarian's recommendations on what the timing schedule should be for the cleanings. And we can chat about cats too later, because I do want to talk about the cats as well. But every dog is very individual.
So what about cats?
So cats, typically every 2 years at a minimum. Cats are notoriously good at hiding their disease and hiding. Cats have a really advanced, almost like a cavity-like condition. It's called a resorptive lesion. It's extremely painful. And I do want to go back to talking about, we forgot about what our clinical signs are. In cats in particular, either hypersalivation, or they just might not be grabbing their toys that they normally would be playing with. And if a really astute owner might notice like a facial twitch when they're eating, you may see that. But otherwise, you might not notice it. So again, having your veterinarian do a good, thorough oral exam. For some of these kitties that are a little fractious, it might be hard, but having them do a real good, thorough oral exam every time that they're in is important. But for the dogs too, hypersalivation and dropping food when they're eating their kibble, if they're dropping food, hypersalivation, and sometimes they will wince. But I would say just doing a good look at your dog's teeth, like every couple months or every month or two, is a really good idea. And then we'll get into toothbrushing in a little bit. I want to get into that too.
Okay, so having that regular dental routine is important. And would you say that it starts with maybe your dog being comfortable with you putting your hands in their mouth, because let's face it, not all dogs are really keen on that idea.
You are 10 steps ahead of me. So this really starts, and this starts when they're puppies. This starts with opening their mouth, looking in their mouth, looking in there. If we can start to introduce a toothbrush at that time, that is fantastic. Less than 0.5% of owners of dogs brush their dog's teeth, and that's understandable. It is challenging to do. It's not easy, and you got to do it. You have to do it every single day. If you don't do it every day, you don't break up. Yep. If you don't break up the biofilm in your dogs, just like us, if you don't brush your teeth every 12 hours or every 24 hours, you start to feel. You ever hear that expression, like you've got sweaters on your teeth, or you've been camping for 3 days and I haven't brushed my teeth for a day? That's porphyromonas growing a biofilm on your teeth, and you have to disrupt that.
Okay, so you got to brush. Do you need to use toothpaste?
No, you don't. The toothpaste is really just to get stuff in, to be able to get a treat flavored, so that they will just go ahead and let you do that.
To kind of lure them in?
No, but there's not like extra fluoride. Yeah, exactly. It just sort of lets you get the biomechanical action of brushing. It gets that done.
Okay. All right. So, this is probably
got some work to do.
We got a lot. I mean, every day, but if you can start when the dog or the puppy.
Start young. Looking at, and if I can get owners in the habit of brushing even in every couple days, selfishly, what I'm doing as the doctor, I'm getting that owner to open the dog's mouth and look in their mouth, and getting them used to knowing what's normal in there, what's not normal. Because I have people that look at a tooth and some of the premolars in the back are kind of oddly shaped, and people are like, "Is this normal? Is there a fraction here?" And I'm like, "Well, I can't." They'll call me and they'll be worried, and I say, "Well, what does it normally look like? And have you looked in there before?" And so, anyways, I'm kind of tricking my owners into getting an exam every day, every couple days.
I think the only time I ever actually looked in my dog's mouth was when he got a twig stuck in the roof of his mouth, because I couldn't figure out what was going on there.
What are you eating?
I know, and the vet found it, but I didn't, and I should have.
Ruhland, butter. Thanks so much. Butter's over it.
Yeah.
Have a great week.
She's like, "Where's my treat?"
And by the way, if you'd like more information, you can head to stpaulpet.com.